Hi, my name's Lindsay, and I'm a graduate counseling intern here at Queen's University.
Hi, my name is Aaliyah, and I am also a graduate counseling intern here at Queens.
We'll be talking to you about anxiety and depression, what these things look like, and knowing when to ask for help. So, anxiety is the top presenting concern for college students at about 41.6%, and this is followed by depression at about 36.4%. Thanks to COVID and what's going on around us, colleges and universities have seen an increase in both anxiety and depression in students.
Okay, so what is anxiety? Anxiety is a natural response to stress, and it's the most common mental health problem, as we just went over a couple of numbers that show you just how big of a deal anxiety really can be. But it's a feeling of worry, nervousness, or unease, and it's typically about an upcoming event. So typically, anxiety is surrounded around being worried about something that's going to happen in the future that hasn't happened yet. But yeah, it's very common. So about 40 million people, adults ages 18 and up, have anxiety. So if you are one of those people, you are not alone. It's very, very common. Many of us have it. So that's about 18.1% of the US population every year. It's pretty big. So how can anxiety look different for everybody? So anxiety is not going to look the same for everyone. It may look one way in you, but your friend might experience anxiety in a completely different way. So experiencing some anxiety can be okay, right? Anxiety isn't the end all be all. It's not the worst thing in the world. But a manageable amount of anxiety can be helpful and even motivating. So anxiety essentially is what might help us to get out of bed in the morning and be productive. It's what helps us to get our homework done on time and meet our deadlines. It's what helps us to be on time for class and do the things that we're supposed to do. So this type of anxiety can push us forward and contribute to us getting things done and being productive humans, right? So this could be studying for a test, celebrating something, preparing for an event, any of those things. But experiencing too much of it, this is when it might become a little bit more problematic. So anxiety can become a problem when it's unmanageable, overwhelming, and comes unexpectedly. So if it's not helping you to get things done, but maybe preventing you from getting things done, then that's when you know, okay, there's too much anxiety. And this can have a huge impact on your life and sometimes can make you feel even trapped in your own thoughts or your own feelings if it is too overwhelming. So this is when you really know that anxiety has become an issue. So which is it? So you have everyday anxiety and then there's an anxiety disorder. So it's kind of similar to what we kind of just talked about. But here we kind of lay out a few of examples. So worrying about paying bills, landing a job, if you just had a breakup or other important life events, that's kind of everyday anxiety. Anxiety disorder, in comparison to that particular example, constant, constant worry, it causes significant distress and it interferes with your daily life. So kind of like how we talked about before, like if the anxiety is kind of stopping you from being productive or getting things done, then that's where it becomes more of a problem. Embarrassment or self-consciousness in an uncomfortable or awkward situation, also very normal. We've all had our very awkward moments, our times where we're kind of like a little bit more self-conscious. That's normal. Avoiding social situations for fear of being judged, embarrassed, or humiliated. So everyday anxiety would be maybe you went to that event that they were hosting and you experienced a little bit of awkwardness versus avoiding it. Maybe you didn't want to go or did not go and attend that event that maybe you wanted to attend because you were feeling anxious. A case of nerves or sweating, totally normal. Out of the blue panic attacks, it's not normal. Preoccupation with the fear of having another one, that is also a really big red flag for anxiety disorder versus everyday anxiety. Realistic fear of a dangerous object, place, or situation. Okay, so I'm scared of snakes. I think that's pretty normal. If I see a snake, I should probably get a little anxious. I should probably run. Irrational fear or avoidance of an object, place, situation that poses little or no threat of danger. So I don't know, something that maybe not as scary as a snake or a bear, but it holds no threat to you, but you're still kind of afraid of it. Something to consider for anxiety disorder. Anxiety, sadness, or difficulty sleeping immediately after a traumatic event. So I don't know about you guys, but I know that plenty of people during this time, there's a lot of anxiety, there's a lot of sadness, and a lot of people are having trouble sleeping and are having a lot more, I guess, run-ins with anxiety. But those types of things are totally normal. But on the flip side of that, if you are having recurring nightmares, flashbacks, feeling emotionally numb, and it's related to a traumatic event that occurred several months or years before, then that is telling of a anxiety disorder as well. So these are just some really good ways to be able to think of the differences of just like, is this everyday normal anxiety, or is this anxiety that is stopping me in my tracks and that's not helping me to move forward?
Okay, so now let's take a little look at depression. So what is depression? This is a mood disorder that causes a persistent feeling of sadness or loss of interest. This will affect how you feel, think, and behave, and it can also lead to a variety of emotional and physical problems. So 322 million people worldwide live with depression, and this is about 6.7% of adults in the US. So, does depression look the same for everyone? No, it also looks different in every person, every age. So we're going to go over a little bit how it looks different in women, men, and then also older adults. So depression in women often has to do with biological, life cycle, and hormonal factors. These are obviously unique to women, and they could be linked to a higher depression rate. And the symptoms that are oftentimes related to this are feelings of sadness, worthlessness, and guilt. So now shifting to men, men are more likely to be very tired, oftentimes angry and irritable, losing interest in work or activities that they did once enjoy, sleep problems, behaving recklessly, and can oftentimes include the misuse of drugs and alcohol. One important factor to remember is many men do not recognize their depression, and that leads to them failing to seek help. So looking at depression in older adults with depression could have less obvious symptoms on the surface, or maybe less likely to admit to feelings of sadness or grief. In addition to that, they're also more likely to have medical conditions such as heart disease, and this could contribute to the depression.
So how do you know when you need help, right? So we've kind of touched on this a little bit with the anxiety of kind of like knowing the differences between when it's normal and when it could potentially be something a little more serious. But here are some pretty common signs. So feeling nervous, restless, having a sense of impending danger, panic, or doom, increased heart rate, hyperventilation, sweating, trembling, weak and tired. You can't concentrate. Maybe you're having trouble focusing on your schoolwork. You're having trouble sleeping. So maybe you're sleeping a little too much or a little, or just tossing and turning in your sleep is also another thing. Maybe you're having some nightmares or something like that that are recurring. Experiencing GI problems. That's also a very, very common way that anxiety shows up in your body physically. Having difficulty controlling your worry and having the urge to avoid things that trigger your anxiety as well. So these are all some telltale signs. How do you know when you need help with depression? So some common signs of depression: persistently sad, anxious, irritable, empty mood, loss of interest, and things that you maybe found enjoyable before. So if you are an avid runner and lately you don't have the energy or the desire to run or spend time outside, then that's a sign that maybe, you know, something's a little off. You're withdrawing from your friends and your family. Maybe you're not wanting to be around people as much. Trouble sleeping, or you're sleeping too much. Significant changes in appetite and or weight. So maybe you are eating a lot more. So that's also common. People that are depressed, they might eat a lot more, especially carbs in particular. Or maybe you're eating a lot less. You don't have an appetite. You're not in the mood to eat. And then whether it's connected to the food or not, your weight may, you know, you may lose a lot of weight when you're depressed, or you may gain weight. So it could be because you are eating more or eating less, but that's one of the things as well. Difficulty concentrating, like we talked about with anxiety. And you'll notice that some things that show up with anxiety may also show up with depression. I think of them as like brother and sister sometimes, but they are different. Feeling worthless, feeling hopeless, feeling this guilt, persistent physical symptoms, substance abuse problems. So maybe you are engaging in alcoholic beverages more, or maybe drugs or something like that, and that becomes an issue. And the last one is thoughts of suicide or suicide attempts. And so we're going to talk a little bit more about that. So how do you know when you need help? And here are some signs of suicide. So this could be you, or this could be a friend. So these are signs to look for, not only in yourself, but in others. So if you or your friend are talking about feeling hopeless, not having a reason to live, feeling like you're in this kind of trapped or unbearable pain, those are very key words that your ears should perk up and say, okay, wait a minute, red flag. And along with that, I mean, the one before, the depression slide, the signs of depression, a lot of these are also going to look similar. So just keeping that in mind, bearing in mind that depression and suicide have the potential to look a little similar, but in suicide, you'll notice that it's a little bit more elevated. And with depression can lead to signs like these different signs of suicide that I'm about to talk about as well. And like we said before, like it's going to look different. Everybody's not going to look the same. And talking about it is not an issue. And we'll talk about a little bit more about that when we talk about how to help someone. But don't be afraid to talk about it with someone else, whether it's you with the suicidal ideation or whether it's a friend or someone. So talking about wanting to die or kill oneself, because oftentimes, and I believe it or not, if someone's willing to talk about it, it's a very strong possibility that they don't actually want to die, rather they're looking for someone to help them, and they don't actually want to commit, or they don't want to actually kill themselves. Talking about being a burden to others, withdrawing, feeling isolated, looking for ways to kill themselves. So like maybe they're Googling different destructive ways, destructive things like buying a gun or something. You might see an increased use of alcohol or drugs. They may seem anxious or agitated, like really annoyed, kind of like on edge or keyed up a lot more than maybe they have before. They might behave recklessly, or show signs of rage, like they're really angry, or like have these really extreme mood swings. They may be sleeping too little or too much, which we also saw on the list for depression. And then maybe their social media posts are kind of questionable and mention some of these other topics that we have already mentioned. But these are all signs that someone could potentially be thinking about suicide.
So how do you help a friend if any of these signs come about, or if you're starting to feel worried? So non-judgmental listening, huge. Just being that person who is genuinely invested, genuinely cares, whether that be a sounding board for your friend, talking about different emotions that they're feeling, just being there for them, and not judging the different things that they might be going through and feeling in that time in their life. Trusting your instincts, huge. So that feeling in your gut that something might be up, that your friend might be in danger, they might be struggling. trust those feelings, because it's better to get help and see what's going on than ignore those signs. You can also reach out for help on their behalf. So maybe you feel a little hesitant on how you should approach the situation. There are so many resources out there, so many people who are willing to help, so you can reach out and do that for them if you kind of feel like you're stuck in that aspect. Along with that, encouraging them to seek professional help. So normalizing this part of life that they're going through that is very difficult, but understanding that it's okay what they're feeling and that they can see somebody who is trained, who will be there to help them and talk to them about what's going on and what the best plan of action for them is. Along with trusting those instincts, not ignoring the signs. So if you see something there, it's not settling right with you, doesn't seem to be the type of person that you know them to be, don't ignore those signs. Get the help you need, talk to them, be open. So referring a friend to resources, and along with this, you can ask, will you go with me to get help? So kind of placing yourself in that situation with them, being their support, being their rock, and helping them to start these first steps in getting the help. Don't be afraid to ask more questions if you do suspect something's going on. So just being that person that's there, that wants to know, that wants to listen, that wants to engage in conversation. That can be huge, and sometimes it's bigger than any of us think it is, and it's immensely important. And if you suspect that a friend has planned for suicide, call 911. Once again, better to just get the help that you think they need. If you're feeling kind of iffy about what they're going through, what they're saying, how they're acting, don't hesitate when making those calls. So kind of a way to wrap these different bullets up about how to help a friend is looking at this QPR. So this stands for question, persuade, refer. And this allows you to help an individual until expert care arrives. Just like CPR, you are not a heart surgeon, but in QPR, you are not a counselor, but this kind of gives you the power and skill set to help an individual stay safe. So how to cope? There are many ways, different ways to look at this, many different techniques and skills that we can keep and pull out when needed. Some of the ones that we're highlighting is talking about what you're experiencing. So once again, what are those emotions? What are those feelings? What are those behaviors? And getting them out. Relaxation techniques such as deep breathing and grounding exercises. That's bringing yourself back to the present. What's going on with me? Taking that deep breath, bringing yourself back, relaxing, and then moving forward from there. Using social support, using those people around you that care, that are invested in you, and that want to make sure everything's okay. And then going back to the seeking professional help, knowing when to take those next steps to seek professional help and find out what's going to be the best for you moving forward. It can also be helpful to learn what triggers these anxious feelings and emotions. Recognizing and writing down your thoughts and feelings can also be helpful. Once again, just that kind of cleanse of getting them out, then going back, processing them if need be, and moving forward from there. Self-soothing is another important one that kind of can go along with the relaxation techniques. And this is basically just doing something that completely absorbs your interest. So this could be something like getting physical exercise, cuddling up with a pet, watching a favorite movie, anything that kind of soothes your body and gets you back into that place of grounding and feeling more present and relaxed with what you're doing. This is an interesting one, but doing your best. So instead of trying to reach that height of perfection, which we know is impossible, recognizing and being proud of however close you get. So really taking an interest in yourself and being proud of how well you've done, how far you've come, and giving yourself that credit and understanding how important it is. Maintaining a positive attitude, huge. So making an effort to replace negative thoughts with positive ones. Kind of dealing with that cognition of things, how our minds can get overloaded with different thoughts. Oftentimes we jump to worst case scenario. Kind of turning that into a process and getting better and better about replacing thoughts to make your day better and easier for yourself. Getting enough sleep. This is huge. This goes along with the basic self-care. Eating right can go along with this and help. But just taking care of yourself, making sure you're getting what you need to do your best and help yourself succeed in all those ways. Okay, so now resources, which we talked about a little in the previous slide. Resources are huge, and there's so many of them out there. So Queen's Counseling is one of them. Simply email this link that's below to make your appointment. Campus safety, very important number to have. Queens has a safe initiative program. There's also an anxiety and depression support group online. The crisis text hotline, suicide prevention lifeline, and also U Lifeline, which is an online resource for college mental health. So all of these resources, they have links below them, they have the numbers. Please, if you feel like you need to utilize these resources, do it. That is what they're there for. So that is all we have for our presentation today. Thank you so much for watching, and we really hope that all of this was helpful. If you have any questions or want to talk about any of this further, we have listed both of our emails below, so just reach out if you need anything. Thanks, and have a great day.